In our series called Lunch and Learn. It's a complete course in marketing. When you're done with these sessions, you should be able to effectively market your practice. We're going to start by talking about turnkey nutrition. A lot of docs are intimidated by nutrition. They feel like they don't know enough. That simply isn't the case, because 10% of what you know about nutrition fixes 90% of your patients. And actually, the doctors that know a lot about nutrition need to get down to simple basics. Nutrition is a very good way to grow your practice. Unfortunately, when you go to nutritional seminars, they're often not practical, and they often don't help you grow your practice. The information presented is often esoteric. You usually get someone who knows an awful lot of biochemistry, and they're teaching you about their difficult cases. And this is really valuable stuff, but it's a lot like being in third grade and showing up in a college calculus class. You're really not ready for it. And unfortunately, a lot of the nutritional information is not structured in a practical manner. The other end of it is, if you start taking basic nutrition and learning about vitamins and minerals and such, it's really hard to incorporate that into your practice and effectively market. So it seems like you need to do a lot of studying to get a little bit of benefit. And really, it is much easier than you think. Okay. A lot of these classes assume you're already practicing at a certain level, and you may not be. And seldom are you given a system that's marketable. I know there's a lot of concern about insurance coverage, especially among chiropractors. I know there's the issue with Blue Cross Blue Shield. But insurance is kind of an iceberg that gets a little bit smaller every year. And one thing about developing a nutrition practice, you're independent of insurance. I know a lot of doctors say, well, that's not covered by insurance, I can't do it. That's exactly why you should be doing it. With nutrition, you can build a business within a business. The other thing about it is it saves time. Okay, income earned from nutrition does not take any one-on-one time. You improve results. If you're doing something, even if it's simple, if it makes sense and it supports the body's biochemistry, your results, even if you're a musculoskeletal chiropractor that just does adjustments, you're going to do better. I've seen patients that had that runaway inflammation. I remember one lady, she had fingers like little sausages, and she was troubled. She screamed when she got on the table. And what fixed her was anti-inflammatories and bed rest, which tells me she had runaway inflammation. Most disease, most pain, most things that go wrong with your patient is due to inflammation. And with nutrition, you can address that. Okay? And it will expand your practice in a marketable way. If you do simple nutrition, you will actually attract certain types of new patients. And also, if you're not doing nutrition with your existing patient base, that is a way to increase your income with those patients. About 60% of all Americans take supplements. So let me ask you this. If 60% of your patients spend $60 a month on vitamins in your office, what would that do for your income? And as we stated before, this takes almost no one-on-one time. I know with chiropractic, I'm a chiropractor, so I'll talk about chiropractors a lot, but this applies to any natural health care practice. You spend one-on-one time with your patients. You ask a chiropractor how he's doing, he'll tell you how many patients he's seen. With nutrition, that income is coming in without you physically seeing the patient. And it really does improve results. I know writers use the acronym KISS, K-I-S-S, which is Keep It Simple, Sweetie. This is true for nutrition as well. Even if you're already practicing nutrition, it really behooves you to go back to basics. Okay, I remember a child came in, 4 years old, had ear infections twice a year for most of his life, and I wasn't sure how to give. I was thinking about candida cleanses and all this other stuff, but he was 4 years old. I couldn't do that much, and he came in with like a purple dyed sugary drink and Ritz Bits, so he's in this chemical diet. We changed his diet and gave him some probiotics. We had a flavored essential fatty acid and a biotics liquid, multiple vitamin. I never saw him again. Although they kept buying the supplements, because the kids stopped having the infections. With nutrition, if you're going to do something really effective, you address two basic things. Inflammation. Most of disease is caused by inflammation, including cancer, heart disease, and everything else. and nutrient deficiency. People are eating a lot of junk and they're deficient in basic nutrients. So if you address those two things, no matter what else you do, you're going to get a better result. And the easiest thing to do is to have a handout. You want to address inflammation with every patient. We use, with Whole Health America, we have a handout called Eat Your Way Out of Pain. And it's all the stuff that your patients should be doing anyway: avoiding sugar, avoiding refined carbohydrates, eating a alkaline ash diet. If you don't want to talk about it that way, talk about a diet that's dominant in fresh fruits and vegetables. And this explains to them how this brings down inflammation. We got the catchy name Eat Your Way Out of Pain because that's something patients can relate to. The thing that this does, you can say this over and over and over again and talk till you're blue in the face, and it's hard to get compliance. If you have something printed that you can give to the patient, if they are able to download it from your website or from your Facebook page, this just makes your job that much easier. And you can market the approach. You can use this report as a marketing tool. So you add basic supplementation. Now you could just give everybody a multiple and some fish oil, maybe a probiotic, kind of a knee-jerk way, and you've got a nutritional practice, and your income will go up. So if you're not selling supplements in your practice, you're missing the boat here, especially with insurance payments for treatments going down. Most Americans eat too much junk. Okay, and by giving them basic supplementation, the anti-inflammation diet, they'll just do so much better, and you'll make some more money. We recommend for our clients to refine it with a simple questionnaire. We actually have a questionnaire that we will put on a Facebook page. We can put it on your website, and it's a way for the patient to get an idea of where their problem areas are. We've created a handout that will tell you if you do absolutely no nutrition, you know nothing about nutrition. We've actually fixed it to where you can just kind of do a knee-jerk result. And we'll show you that later. Okay, and having the questionnaire makes your supplementation program very marketable, because you can have people come and take the questionnaire, bring it in for a consult. Okay, it's a way of ushering people into your office. Okay, so you want to structure your program in a way to attract patients, and you can do this very simply. And we're fond of saying that when you're marketing, the wellness care program that we've put together is a template. Once you've mastered that, you can market other things. You can market for headaches, you can market for asthma, you can market for weight loss. All you need is a report, newsletters. You can use the same evaluation form, you can use the same quiz over, for other conditions. And you've got a marketing system, and it can grow with you as your knowledge grows. The reason we're pushing wellness right now, it is because it is something that someone who knows absolutely no nutrition can do in their office. And if you're already fairly knowledgeable about nutrition, it's probably a good idea to do it anyway, because I personally have found that my job has gotten a lot easier using the anti-inflammatory diet and just basic supplementation. And a lot of times, things that I think I'm going to have to really work on and figure out and do blood tests for, I really don't have to. And the very first step that you want to do is you want to have written material. This is part of your marketing plan. You want to offer something like a wellness report, okay? And you can have people download it from your Facebook page. You can have them download it from your website. There's ways of doing that. You can create landing pages, something called a landing page. If you contact me, I'll show you how to do that. If you talk to Darcy, we actually will give you a manual that will show you how to do this. Okay, we'll tell you how to get that book at the end of this. So you start by giving away some kind of written material, report, newsletter, and every written piece has to have an offer. And the offer usually is for a free evaluation. And as we stated earlier, the easiest thing for an evaluation is to have a questionnaire on your website or on your Facebook page. If you have them come in for an evaluation, if you do have them come in and do a physical evaluation, you don't have to do a full new patient exam. You can do some basic testing, vitals and some muscle testing, or something really simple to get them into your wellness program. Okay, we even have. We'll show you how to get the wellness marketing book, which will have printed questionnaires that you can actually just give them. So if they show up in your office wanting an evaluation, you can give them the printed questionnaire. We've got a key for that, tells you how to interpret that for them. And then the third step, when they take the evaluation on Facebook or on your website, you offer them a consultation. Come in with the results, and we'll go over them with you. This may be a little bit hard to see, but the questionnaire that we have for you on Facebook, we'll find problem areas: digestion, general nutrients, allergies, blood sugar, adrenal, and so on. Now, what we've done for you, in case you're not really familiar with nutrition, we've written a key, in other words, suggested protocol, supplements for the main area. And so when someone shows you with a highly problematic area, you pick one. They're also kind of in order. So like if digestion is like here, this person has like 4 moderately problematic areas. Digestion's always a great place to start. Okay, digestion or blood sugar. You can just pick one. You give them the anti-inflammatory diet. You give them the supplements that are suggested. Like I say, we have a handout for you. And that's it. Have them check back with you in 60 days. Now, if they have other complaints and you want to do a general history, like if they got if they got back pain or headaches or something like that, and you have a regular treatment protocol that you do for that, now is the time to get them to come in for a full exam and so on. And it's a great way to grow your practice. And we've actually, if you find Ray Bisveck, Biseveac, or Darcy Langdon, go to Facebook.com and search these two folks, and they can provide you with a marketing wellness quick start kit. And in that, Whole Health America is working with them, and we will put a questionnaire up on your Facebook page for you. They have a report on whether the supplement's good. They will give you a poster for your office, and this is a very good way to start marketing nutrition within your office. And you want to use this wellness program as a template, whether you're doing headaches or back pain or anything else. It always starts with a report, a newsletter with an offer of an evaluation, and an offer of a consultation. Now, if you're dealing with nutritional issues, you can use the same questionnaire, whether it's for detox or anything like that, and then take care of the differences during the consultation. This prevents you from having to do many kinds of questionnaires. And what we're talking about is something called turnkey nutrition. Okay, wellness care is a turnkey kind of a program, and it's the reason we're starting with that is something that anyone can offer in their office, even if you're Joe Orthopedic and never given a vitamin in your life. This program can work for you. It takes very little training. What you have to understand, that if you've been to nutritional seminars, a lot of times they treat things almost like medical doctors, like and what I mean by that is they're addressing symptoms. You're going to take the adrenal spit test to find out if they're hyperadrenal or hypoadrenal, and you're going to make that distinction. It's going to determine which supplements you take. Okay. And that's useful information. I don't want to denigrate that. But the point is, most people are unhealthy for very simple, very general reasons. And the other point I want to make is that nutrition, chiropractic, actually all natural health care, is about building infrastructure. So if you have a built-in easy way to improve your patient's infrastructure, your job gets much easier. Okay, now of course you will have your problem patients, and then you can go and watch the nutritional expert, and they'll tell you, because you're not going to get everybody perfect all the time. You get 90% though. But there will be that occasional problem person that, oh yeah, I got to take them off. I got to find the gluten sensitivity, or oh gee, yeah, they've got a heavy metal problem, or and that's where these other seminars are very useful. But it's really good to get into the practice of using nutrition and watching your patients get better with very simple nutritional programs. And the beauty of it is it increases your income without costing you more time. And here's some suggestions for other things. At Whole Health America, we're going to add a lot of these reports we already have. You can do weight loss. Well, we have reports for weight loss. Drug therapy support. What I mean by that is if you have somebody on statin, you can do this right now, okay? And I guarantee you, if you have somebody taking cholesterol-lowering medication, they don't feel very good, okay? If you give them 100 or 200 milligrams of CoQ10 every day, they will feel much better. Okay, and you're probably saving their lives by doing that, because depleting CoQ10, as the drugs do, often forces people into heart failure. There's a lot of other things that drugs do, and what's really nice, Darcy and Ray can help you with this sort of thing. Think of this as a way to start, and each little fact that you pick up is going to make you more effective. Okay, insulin insensitivity. It's like 60% of Americans are insulin insensitive. Okay, in which case you're using glucobalance as your multiple vitamin. The anti-inflammation diet actually works for that because it is also a low glycemic diet. In other words, we're taking away the sugars and the starches and so on. The 3-step detox is very turnkey. You set people up, you give them their information, and you send them on their way. And what's nice is you can market these sequentially. You can market wellness for a while, then you can market detox, and then you can market weight loss. And keep a steady growth in your office. Now, if you the questionnaires and the protocols from the questionnaire are in this book called Marketing Wellness in Your Practice. Okay, we will put, if you contact Ray or Darcy, you can find them on Facebook. Just search them out on Facebook, and you can actually download the report right then and there. And you can download the vitamin. Is it a good vitamin report? Because for a lot of people, you recommend a multiple vitamin and they find it at Walmart for $10 cheaper. We actually have written a report to explain to them why that's not a good idea, and it's a good thing to have in your office. But everything you need to know about marketing wellness is in this booklet, and you can extrapolate it out to, because the same pattern goes for marketing detox, adding nutrition for headache. Even if you have people with headaches, if you're a chiropractor and you adjust people with headaches, there's some nutritional things that you can do that will improve your results, and you can go ahead and market for headache patients and so on and so forth. At Whole Health America, we have these tools for you, and we'll build your Facebook page to where all these reports are downloadable. And this is a good place to talk about the Facebook page. You really want to have a Facebook page. It's a business page. It's different from where you have your friends and do all that. This is designed for your business. One thing that Whole Health America does for you is we can add tabs. We can add these reports. We can have people download the diet. We can actually set it up so they can take the questionnaire right on your Facebook page. You can contact us for that. We also provide you with newsletters for your waiting room. It's very important. And finally, when you have the marketing system in place, you want to get your message out dirt cheap and free. And the easiest and cheapest way to do that is with your Facebook page. Okay, a Facebook page, if you've got your current patients liking you on Facebook, then all their friends and family will see your posts. It's very important. We've got 2 segments on Facebook. It's so important. Definitely advertise in your waiting room. If you see Darcy or Ray, they can set you up with a poster for your waiting room designed exactly to get your patients on a wellness program. Emailing to existing patients. See, when people think about marketing, they think about getting out into the world and getting other people. And that works, but it's the most expensive kind of marketing. Your question, and especially if you're, if money's tight, is who can you cheaply and easily reach? Okay, and if you don't have that 60% of your patients taking supplements from you, you want to reach out to your existing patients and to their friends and family, and that's the easiest way to grow your practice. I'm Dr. Varnes. This has been a sample of our Lunch and Learn program. I hope you enjoyed it.